Welcome back, dear students. First of all, I would like to wish you all a happy World Pharmacist Day. In this point of pharmacy practice, we have completed about the prescription medication orders. What are they? Their differences, how to interpret the both, which are the different terminologies or abbreviation used, how should be the what are the responsibility of pharmacist as well as the doctors while understanding the medication orders and prescription that we have gone through. Then also we have studied the legal requirement or legal aspects of these prescriptions and medication orders. And in last lecture we have started the second point or the major point in this chapter, that is communication skills, the communication in between the healthcare professionals like doctors, that is prescribers, pharmacist, patient, even several times the nurses were involved in this. So communication is said to be the most important aspect when you need to get an effective treatment, or when you want the patient to be feeling better during its contact or with the all medical professionals which are there. Okay, so this skill is very important. When we say the communication there, the pharmacist should be having the understanding of different messages, definitely the information what they are sending. Okay, that also we have, I think, gone through in detail. Communication is a transfer or sharing of information, knowledge, emotions, and many other things from one to another or one to many. So this process is having the involvement of at least two personnel uh, are needed for this. It is again two-way interaction. Uh, when we say communication is effective only after a proper understanding of the message here means the information which has been sent by the source or the sender. Then here the sender may be any prescriber, patient, pharmacist, nurse, okay, and receiver can also be from amongst them. So that is what communication is there. While communicating with one another, the source, that is sender, when sending the message, they are encoding it. Okay, encoding means they are converting the information from one system to another system. The codes may be in the form of signs, symbols, or different letters, okay, which generally used to represents the meaning, might be secret meaning. uh, the message were sent through a medium which is called as a channel. That channel is maybe of different type. Okay, it can be face to face interaction, might be written form, might be telephone meeting, magazine, television, that is, it might be wireless or might be having use of cable or in-person contact. That is, these are the different channels generally having their involvement in the process of communication. Then decoding, the receiver, generally when they are understanding the information, they need to be uh, make clear what actually the meaning of the message which has been sent by the sender. Next are the receivers, or the person who are uh, needing the information or who are involved in the communication process. They should be properly understanding the message. For that, they have to listen with concentration or with 100% attention towards the sender. Nextly is the feedback. Feedback means when uh, the message has been understood by the receiver, they need to be, means the sender has to assure whether they have understood properly by asking different questions, or might be checking uh, whether they have made certain errors during the communication. Okay, that is the feedback. And lastly, the last what it is called as part of communication process is the context. It uh, it means the environment or the surrounding circumstances when the message has been transferred from the sender to the receiver, what is called as the context. So all these context uh, or all these parts of communication process are very important. Okay, they should be properly chosen, and their effect is vital when we need to get the communication done effectively. So in this case, when we say uh, professional healthcare professionals, when they are communicating, they have to be very specific while choosing the message, while encoding, while choosing the channel, the decoding, and also getting the feedback. So these all aspects should be properly understood. So what is their different messages, what they are sending should be chosen effectively or properly. All these things we have covered. uh, Also, we have started the non-verbal communication, okay, in different types. Generally, the verbal communication and non-verbal communication are there. Non-verbal means there is not a involvement of the words over there, okay, in any form. It's simply having the involvement of the body movement or body posture which is there. Okay, examples also we have uh, completed. Okay, cross arms and cross legs means the barrier in the free flow of the message over there, while not paying attention towards the sender. Okay, while during the communication, it means it is a problem. Okay, or it is making in barrier in the complete understanding of the message or communication process. Then if any person is uh, saying they are not attending the person to the sender, okay, when this condition is there, we can say the person is not interested in the process of communication. Okay, and they may be appearing restless or uneasy, and they want to end up the communication process, or they want to divert to the other message, or the other topic should be changed. That is what they are signaling actually when they are not attending the communication. So what we can do, okay, as a pharmacist, we have to simply change the topic or end the communication. Even in this non-verbal communication, all the facial expressions are very important, and they are sending the message about their emotional status, what they are feeling at during the process of communication, definitely the eye contact is also another important aspect in the communication. Okay, if anybody is firm with their knowledge, okay, they will be speaking with eye contact. Okay, if they are not lying, again, that is honesty is shown over there, the confidence is shown there. Okay, when the eye contact is continuously found in both, also is a type of non-verbal communication. Then there should be use of specific labels. You can also have, might have seen or found some pictures over the containers of the medicines. Generally these are for the illiterate people, illiterate who are not educated, or even they are educated, but they are not aware about different terminologies of our pharma world or healthcare uh, words are not known to them. So in that cases you can have certain diagrams or certain sort of indications were kept over the label, and that is also a type of communication you are doing. Okay, then uh, you may also have certain explanation to the administer means the patient, particularly for how much is the quantity of eye drops is to be given or put into the eyes. That may be indicated by using by showing the one or two drops over there. So drops are simply the diagram of the drop were put over the um, labels, okay, or over the containers, which is sort of a communication. Now verbal communication is also important aspect. Here you are using a number of words, different languages were used in this verbal communication. Those are spoken by the sender as well as by the receiver, and along with that speaking, they are also having several times the involvement of communication, the verbal communication, which is definitely are called as the written communication. So those might be in the form of words, symbols, or numbers, which are giving certain message to the receiver. Okay, meaning of the words can however be altered by non-verbal aspects of voice tone or accent. Sometimes the same word we're having different meaning depending upon the tone you are using, or different accent which are used while speaking the same words. So we should be careful while choosing a proper tone while doing again the verbal communication with one another. Okay, because just I told, there are many words which are having a different meanings, even though they are having the same spelling, okay, or the words are same. So we should be very much choosy also if we want to make a proper communication with the people, depending upon the situation or the condition which are arising over there. Okay, Then uh, the tone, the pitch, that is how much stress you are giving when speaking the words, the quality, the rate of speech is the speed by which you are speaking. Okay, these all are also having more weight, means their uh, importance is more than the words which are used during the communication process. So you should be properly utilizing such things if you want to have a effective communication with the person. These all tone, what is called as rate of speech, these all they are said to be conveying the emotions of the sender and the receiver, definitely, and as well as they are also making the clear understanding what might be the meaning of their words during the communication, regardless of the content. So several time by this uh, thing which are called as tone, pitch, quality of speech or rate of speech, they will be giving you the more easiness to have a specific understanding or specific transfer of the message, okay, from sender to the receiver. Next point is the language. Definitely, this is also important aspect. When we say the verbal communication, both the sender as well as receiver should be aware about the terminologies which are used during the communication, the words, and we know when we say any specific language is there, okay, they are having the involvement of similar words. When we say English language, okay, then Marathi, Gujarati, likewise, when two persons were involved in the communication with one another, if both are using the same language, it will be more effective communication generally, which is said, okay, as they will be understanding the 100% understanding will be there. Okay, there will be no any word which is not understood by one another, because what just I told, in the process of communication, the decoding means interpreting the message is very important. If you are not able to convert the coded message into your or actual meaning of that word, okay, you won't be thinking or saying that it is a complete or effective communication has taken place. So language is important aspect. Okay, the both parties means the sender and the receiver, they should be understanding the language what they are using in the communication. Okay, they must be fluent as well as comfortable while using that language in their speech or during their communication. Developing and using a professional word as well as being familiar with everyday terms are vital aspects generally in this clinical pharmacy education and clinical practices which are there. The professional words which are called as the jargon, specific terminology is there. Okay, jargon means these words are only used by a specific type of or specific professionals. Like if we say this medical professionals are there, they are knowing, uh, they are using those words, okay, which are used in their professional only. Again, if we'll take the another example, the lawyers, okay, they will be using the terminologies which are understood by their both of them, okay, more properly. as compared to others. So what it is called as the professional words, jargons, and they should be chosen properly. And when there are different people of means the people, sender and receiver, both are of different professional, they should not use these jargon. Generally they should avoid these specific terminologies, okay, because of they want to make a proper understanding of those messages which are transferred from or shared to one another. And particularly in this communication clinical pharmacy or pharmacy practice, okay, the all personnel, healthcare people, doctors, physicians, which are called as, then pharmacists, nurses, they generally uses the terminologies which are understood or regularly used in their profession as a part of communication over there. In the language, there should be many things, okay. In the last earlier point in the same chapter, we have seen the abbreviations, the Latin terminologies, okay, like uh, for oral, okay, or bis and bid, that is twice a day. Likewise, these are the terminologies which are only understood by the professional people, a healthcare professional particularly. Okay, these terminologies or short forms are used but while prescribing the medicines. Okay, they are giving a symbol for a specific type of communication, and they are generally not understood by the patient, okay, hence this is said to be generally to exclusion of patient, means whatever terminologies used when the communication is taking place between the pharmacist, doctor, or doctor, nurse, the terminologies generally not necessarily should be understood by the patient, okay, because when the communication is only taking place in between those two similar profession people, okay, or medical care team. It is said that when it is a communication, it is two-way process, okay, bi-directional communication, hence it is called as. Two actions are mainly involved. It is as general understanding, okay, message is sent and it is received. So sending and receiving, these two actions are taking place in any communication. And if you want to get certain purpose of that message completed, means what it is called as reason of the communication to be completed, you should be able to have a two-way communication, okay, means the not only the sender should speak or uh, give the information, the receiver has to also respond, okay, not compulsorily that they should share their knowledge. They can even they can shake their head, or they can have a certain movement of their eyes that they are understanding, okay, or yes, no, okay, likewise the words can be used. So by this way they can show that they are understanding the thing which are been, or the messages which are told by the sender. So then only you can say it is a two-way or bi-directional flow is taking place, and there will be a effective communication which is achieved. The same thing, both parties are actively participating in the speaking and listening and understanding the meaning of communication. They should have a proper understanding, very important aspect, okay. Then another thing is the listening skill. Definitely a very important and vital to learn this, that is listening means unless otherwise the receiver is showing its 100% attendance attention, sorry, towards what the things which are being sent by the sender. Okay, what it is called as listening. So it is also a skill. If you want to get the knowledge, okay, there should be a proper listening done. And only if you are listening carefully you can uh, give a feedback, or you can have a your involvement in the communication process. Okay, and if you are not listening you won't be able to answer the questions which might be asked to assure the understanding to you or not. So listening is very vital process, or it is also a skill which is needed to be uh, developed by both, actually the sender as well as listener, receiver. But listener or the receiver should have more this skill as compared to the sender over here. It is important that listener maintains undivided attention and is generally not distracted by any internal or external matter. Okay, definitely the barriers from outside or in the place where the communication is going on, they may have certain distraction arising over there. And if you are having a proper attention, okay, there will not be any sort of distraction happening if you are a good listener. That is that it is a quality of good listeners. Even internal matters means if you are sad or if you are ill, okay, if you say there is a headache to you, and you should be concentrating over the things what you are which are spoken during the communication. Is a quality of good listeners. Non-verbal signals like keeping a continue eye contact or maintaining continue eye contact generally shows that the attention is there. Okay, or just I told nodding the head, or if you are maximum attention only is generally uh, said. Okay, one person is having 100% attention, when only we can define this, when the person is asking question whether if what they have not understood. Okay, even this in the classes which is there, okay, when we are teaching to students, we generally used to ask the questions to the students, and if you are listening and understanding, then only you can answer. Otherwise you can say this is a barrier. If the speaker moves off the topic, this is also several time possible. The speaker who is there, the sender, they may get a deviation from the topic. Okay, they are what they are saying, and they are sometimes due to involvement of certain words or the sentences in during their speech, they may deviate. So what the receiver should do, or what is the good quality of listener, they should politely interrupt the sender. Okay, politely, excuse me sir, sorry, you have deviated from the topic, can we please go to the regular topic what we are discussing. Likewise you have to make interruption, definitely. Okay, if you are listening, then only it is possible, and reintroduce the topic. Okay, what which has been deviated, okay, by the person or by the speaker over there. Okay, so here we'll be stopping our discussion. Next point about the communication will be learning in the next lecture. Thank you, take care.